Do you hear me, Dr. Eghbaliyan?
Hello. Hello, Dr. Arma. Sargaran. Do you hear me?
Yes, we hear you. Please share your slides, and we are waiting to join hearing your presentation. Thank you.
Do you see my presentation? Okay. In the name of God. Do you hear me?
Yes, we are hearing you. Please start.
Okay,
we have your voice and also your slides. Thank you.
Thank you. Okay. I'm Fatemeh Eghbaliyan, Assistant Professor of Traditional Medicine, School of Persian Medicine, Iran University of Medical Science, Tehran, Iran. Okay, today I want to say about COVID-19 telephone consultation by Persian medicine as an integrative medicine, benefit and challenge. The core of this presentation are saying about why Persian medicine telephone consultation started for COVID-19 and what are the benefits and challenge of it, and finally, what are the main results of it. As you know, COVID-19 outbreak occurs suddenly, and it started in Wuhan, China, and spread rapidly with various clinical symptoms in the world. Okay, since this disease was new and its prevalence was higher than another infection disease such as SARS and MERS, many people have been worried. And therefore, several unnecessary visits to medical centers occurred. The result of this increase the risk of infection for patients and physicians and increase the workload of medical centers. Okay, in this situation, quarantine or social distancing, use prevention recommendation, and reduce face-to-face visits are required to control outbreak. Therefore, it seems that telemedicine is an effective way to achieve these goals. Okay, what are the benefits of telemedicine? Triage and diagnosis can be done without the in-person referral, and the suspected patient can be done without the and suspected patient will be referred to the medical center if necessary. And physician answer to many questions of health seeker about this disease, and they can suggest therapeutic recommendation. Now I want to speak about Persian medicine telephone consultation, PMTC. Why Persian medicine? Persian medicine is an integrative medicine. It is very, very popular within Iranian people, and the School of Iranian Traditional Medicine was established in Pastigate in Iran. And it has provided effective recommendation in the prevention and treatment of many diseases, such as infection disease, respiratory disease in the past. Therefore, by cooperation between Iranian traditional medicine specialists under supervision of medical university and newborn startup, this system was launched. The health seeker are automatically connected to this system by dialing this number, and this website is accessible throughout this URL. Okay, what are the specifications of the PMTC? In fact, this system is user-friendly, high secure, and capable to upgrade. and it does not require the internet service for audience or physician. And it is free because all physicians and startup staff have worked here voluntarily. Okay, now I want to speak about the steps of running PMTC. Before the system running, a very short group, including Iranian traditional medicine physicians participating in the telephone consultation system created. One of the goals of this group was to provide written and verbal education for caller. This recommendation provide in three levels. The first, lifestyle modification, then and dietary measure and medical plan recommendation. These protocols are prepared and based on Persian medicine textbook and the new article and fact sheet of WHO and Iranian Health Ministry about COVID-19. Another goal of this group was discussion about various and new aspects of this disease that, asked by the caller, this activity of the activity of this group have been continued until now. And this second step, I describe how physician can join to this system. Doctor requests to work in the telephone consultation system are sent to the system via SMS. And a specific page is designed for each doctor to manage their active time. Okay, now we review what happened when a person calls. When a person calls, at the first step, physicians fill in the data-driven checklist. Example list. This checklist contains age, sex, underlying disease, contact, corona patient, medication, warning signs, and other some questions. Okay. And the second step, according to information collection, the person is placed in the three group: prevention, treatment, or recovery group, and appropriate recommendation is given to them. And when call ended, the satisfaction of the health seeker were assessed. Okay, what were the results of the activation of PMTC? In time duration, 18 March to 17 April 2020, 43 Iranian traditional medicine specialists cooperated from 6 a.m. to 12 p.m. Totally 2,778 calls and 11,221 minutes of consultation done. About 93% of incoming calls were answered by physicians, and the average length of each call was 4.5 minutes. This figure shows the number of calls per day. As you see, the number of calls was very different on various days. Day and number call. And in this picture, show the main reason for the call. About 11% of call for prevention, and 47% of call for treatment, 15% of call for recovery, and about 26% of call for another reason. Based on this figure, about 80% of callers didn't have any history of contact with the coronavirus patient. and about 20% of them have a history of contact with coronavirus patient. But PMTC has some limitation. Patient in this system unable to perform physical examination and unable to check the result of radiological tests and photograph. But finally, it seems except a few limitations compared with the face-to-face patient visit, PMTC can provide considerable help to prevent and manage COVID-19 outbreak in Iran. Thank you for your attention.
Thank you, Dr. Eghbaliyan, for your nice presentation. If there is any question? Okay, thank you. Let's go to the next presenter, Dr.